Hi everybody, welcome to week 4 of your Practicum course. We are getting there. So this week we are talking about self-reflection. So I'm sure at this point in your career you've engaged in quite a bit of self-reflection, right? You might have reviewed how a shift went, how an interaction went with a patient or a colleague. So self-reflection had maybe even driven you to start your MSN program. So I'm sure all of you have engaged in self-reflection up to this point in your professional career. So self-reflection encourages growth, right? And nurse educators definitely need to continue to grow. This isn't an area where you can remain stagnant. So this week we'll talk about self-reflection for educators and also about creating an environment that encourages moving forward, regardless of who we're teaching. So I think that this is going to be a really good discussion. And to kind of get our juices flowing, I'm attaching a brief article about reflection within nursing that I thought was kind of interesting. It's not very long, so take a look at it and see what you think. Over the winter break, I try to reflect on my courses, working to enhance them, looking at content that I want to incorporate. This year, I started reading this book. It's Teaching and Learning in a Concept-Based Nursing Curriculum. That's what I'm reading for pleasure these days. Anyway, it is proving to be a really good book. And a resource discussed in that book is a vendor called Shadow Health. I'm not sure if any of you are familiar with Shadow Health. Their products involve virtual patient simulation. We've talked about it, I think, briefly, maybe in our first or second week. Patient simulation, virtual. But this one is designed for nurses and nursing students and nurse practitioner students. For instance, they have a basic health assessment module and an advanced health assessment module for nurses and nursing students. And I'm going to attach a link to their website. And if you scroll down a little bit, they have a video about what they do. And virtual reality has played a role in medical education quite a bit. And I think we did look at a site in this course that was geared towards medical education. And some has been done for nursing education. But really, I like this company and their approach and their deep base of automated responses from patients based on the questions that are asked of them. It's really pretty interesting. So take a look, see what you think. I think it's pretty cool. Okay, so that's your resource for the week. At the end of this week, you're going to turn in your NEPD form again. Now, this is the form that you turned in, I wrote comments on, and I gave back to you in week 4. So you want to save the one that I gave back to you that has my comments on it, okay? All right. So if I gave you feedback about your overall practicum objectives, okay, please put the revised objectives up at the very top under Topic 1, Week 1, and talks about practicum objectives or your overall goals. Put the revised ones in there so that we both know exactly what you're working towards. And so for the one that you're turning at the end of this week, you should have filled out all of the columns up through the end of week 4 because it's going to be the end of week 4 this week. And then just below week 4, there's an area that says student comments. And I'd like you to tell me how your experience is going so far, subjectively. Are you having any issues? Is it feeling good? Just how are things going? And then you'll go down to weeks 5 and week 6 and fill out the first 3 columns looking forward to what you are going to accomplish in week 5 and week 6. All right? If you have any questions about this, please just ask me. And I'm really looking forward to hearing more about how your practicums are going. It's fun for me to do that. All right, I think that's about it for this week. So I hope you have a good week, and I look forward to seeing you in the main forum.